Friends, good evening and welcome to my channel Mukambika Nursing. Friends, in this video we can see some questions for exam. This video contains some important question and previous question also. We will see the question one by one. The first question, ecchymotic skin appearance with a closed wound result from a blow is. This is the question and options are option A puncture, option B laceration, option C wound, option D contusion. So we have to read the question thoroughly, then we can easily answer this question. So ecchymotic skin appearance, ecchymotic itself, the meaning itself, it is there, the answer. It's a bluish appearance of the skin, that is ecchymotic. So bluish appearance is coming in case of contusion. So and also question it is there with a closed wound result from a blow. So here contusion is the correct answer, option D. Contusion means is an bluish appearance of the skin that can occur any injury from a blow or a blunt instrument, that is we are hitting our body surface in any area that may cause bluish or bluish appearance, that is reddish appearance over the skin, that is called a contusion. So here option D is correct, contusion. And the remaining option we can see puncture. Puncture means it's a open wound, that is deep wound with sharp instrument, that is puncture. And B is laceration. Laceration means it's also an open wound, that is cutting wound, that is laceration, that is tearing of the soft tissues of the skin, that is called laceration. And the wound, it is not correct in this case. Ecchymotic skin appearance with closed wound, that is contusion. Okay, puncture and laceration are open wound, so it is not correct among the option D is correct, contusion. Second question, in following which is the example of moist cold application? Options are option A ice bag, option B ice pack, option C cold compress, option D ice cradle. So which one is the example of moist cold applications? Here cold applications include local cold application, general cold application. In local cold application include dry cold and moist cold application. Same in general cold application also, dry cold and moist cold application is there. In local cold application, the moist cold applications include ice to suck, cold compress and evaporating lotion. So moist cold applications include ice to suck, cold compress and evaporating lotion. Here cold compress is there, so that is the correct answer. Okay, moist cold application. And dry cold applications include ice bag, ice collar, ice pack, chemical cold pack and ice cradle. These all dry cold application. Okay, so here option C cold compress is an example of moist cold application. Okay, the uses of this therapeutic cold applications include cold release pain and also prevent gangrene, cold prevent edema and reduce inflammation, cold control hemorrhage and also reduces the body temperature, and cold anesthetize the area. Cold can use to anesthetize particular area. Example, cold application decreases the sensitivity of tissue and creates sensation of numbness. So this can used in case of anesthesia. These are all the uses, therapeutic uses of cold application. Next question, the third question, intraspinal injection is also known as. Question and options are option A intramuscular injection, option B intraperitoneal injection, option C subcutaneous injection, option D intrathecal injection. So here intraspinal injection is also known as intrathecal, that is option D is correct. So intraspinal injection is also known as intrathecal injection. So here injections are given into the spinal cavity, that is called intrathecal or intraspinal. Okay, in remaining option intramuscular is there. So intramuscular means into the muscles, injections are given into the muscles. And intraperitoneal means into the peritoneal cavity, injections are given into the peritoneal cavity. And Subcutaneous injection means injections are given into the subcutaneous tissue. It is also known as hypodermic injection. Subcutaneous tissue or hypodermic injection, that is injections are given into the subcutaneous tissue. In our question, spinal injections are also known as option D, intrathecal injection. Next question, fourth question. The movement of water across a semi-permeable membrane from a low concentration to high concentration is. Question, and options are diffusion, option B osmosis, option C filtration, option D osmolality. Here we have to know what is osmosis, diffusion and filtration. Then we can easily write the answer. Okay, here osmosis, here in this question osmosis is the correct answer. That is the movement of water molecule from an area of low concentration to high concentration across a semi-permeable membrane, that is called osmosis. We will see osmosis. Osmosis is the movement of solvent molecule across a membrane in response to concentration gradient, usually from lower concentration to high concentration, that is called osmosis. And another option, diffusion. Diffusion means diffusion of a solute molecules spread from an area of higher concentration to low concentration, that is diffusion. From low concentration to high concentration, that is osmosis. From higher concentration to lower concentration, that is diffusion. And filtration. Filtration means filtration is the movement of solute and solvent by hydrostatic pressure, that is called filtration. And the next option, osmolality. Osmolality is the concentration of solution. So we are usually telling the concentration of solution by osmolality. Osmolality refers to the number of osmotically active particles per kilogram of water. That is called osmolality. So here our fourth question is movement of water molecules across a semi-permeable membrane from low concentration to higher concentration, that is called osmosis. Next question, fifth question. The birth weight of baby triples at. Options are option A 9 months, option B 12 months, option C 15 months, option D 18 months. The birth weight, when the birth weight of baby triples, that is the question. So by at birth the weight of a newborn is about 2.5 to 3 kg. That is the normal birth weight of a baby. So by the age of 5th month or by the age of 6th month, the weight of the baby is doubled. The birth weight doubles by 5th month. Okay, and by the age of 1 year, the weight of the baby is triple of birth weight. So here 1 year means 12 months. The birth weight of a baby is triples at 12 months. So by birth it is 2.5 to 3 kg, and by 5th to 6th month it become doubles, and 12th month it become triples. So option B 12 month is correct. Next question, the sixth question. Talipes equinus is also known as. Options are option A clubfoot, option B diabetic foot, option C athlete foot, option D none of this. So here question is Talipes equinus or Talipes equinovarus is also known as clubfoot. Option A is correct. Clubfoot, in picture we can see the difference of normal and clubfoot. Okay, clubfoot means one of the birth defect. It is one of the birth defect that the foot are turned inward and downward. That is called the clubfoot. It is one of the birth defect. Okay, that is also known as Talipes equinus or equinovarus. And the remaining option, that is diabetic foot and athlete foot, is there. Athlete foot means it is also known as tinea pedis, and it is one of a type of fungal infection. Due to that there is itching, burning and rashes on the skin of the foot. Will occur. That is called the athlete foot. Athlete foot is also known as tinea pedis. And diabetic foot, as we all know, diabetic foot, that is due to the high blood sugar. There is a damage of the nerve endings of the foot, and blood vessels also damaged in the foot area. That may cause, that is diabetic foot. Diabetic foot ulcer under. Next question, the seventh question, all are true regarding H. pylori infection except option A is a gram positive bacteria. Option B is eradicated by triple therapy. Option C produces urease enzyme. Option D cause small tumor. So here our question is which one is not correct regarding H. pylori bacteria. That is our question. So H. pylori bacteria means Helicobacter pylori bacteria is a spiral shaped gram negative bacteria. So H. pylori bacteria, Helicobacter pylori bacteria is a gram negative. Here gram positive it is there. It is a gram negative which shape spiral shaped bacteria. So option A is correct, is a gram positive bacteria, and remaining option we can see this H. pylori bacteria produces urease enzyme, and triple therapy is used to treat this H. pylori bacteria. That is, the triple therapy medications include combination of metronidazole, amoxicillin and bismuth subsalicylate is used to treat this H. pylori bacteria. That is the triple therapy. Triple therapy include metronidazole, amoxicillin and bismuth subsalicylate. Okay, this is used to treat this H. pylori infection. And this H. pylori infection cause gastritis, duodenitis and peptic ulcer, and is also a risk factor for gastric malignancies, which is also known as Malta tumor. Okay, this Maltoma tumor. So Maltoma tumor means one of the risk factor of gastric malignancies, H. pylori bacteria, that is known as Malta tumor, that is mucosa associated lymphoid tissue. That is called Malta, full form of Malta, mucosa associated lymphoid tissue. So here in our question, option A is correct, that is it is a gram positive bacteria. Then the eighth question, which of the following is the father of microbiology? Options are option A Louis Pasteur, option B Robert Koch, option C Anthony van Leeuwenhoek, option D Hansen. Who is the father of microbiology? That is our question. As we all know, the father of microbiology is Louis Pasteur. Option A is correct. And the second option, Robert Koch. Robert Koch is father of bacteriology. And Anthony van Leeuwenhoek is who discovered microscope, who invented microscope is Anthony van Leeuwenhoek. And Hansen is their option D. Hansen, that is who discovered the leprae bacilli, that is mycobacterium leprae was discovered by Hansen. So in our question, father of microbiology is Louis Pasteur. Next question, ninth question, which of the following drug can cause cartilage damage in children? Options are option A penicillin, option B metronidazole, option C ciprofloxacin and option D all of this. Here question is which drug can cause cartilage damage in children? Here in our option C ciprofloxacin can cause cartilage damage in children. This ciprofloxacin is an broad spectrum antibiotics used to prevent or inhibit the growth of bacteria, that is ciprofloxacin. It's a broad spectrum antibiotic that may cause, the use of this ciprofloxacin cause cartilage damage in children. So option C is correct. And the 10th question, length of fallopian tube is about. Options are option A 10 centimeter, option B 20 centimeter, option C 15 centimeter, option D 25 centimeter. Here our question is length of fallopian tube. Normal length of this fallopian tube is 10 to 12 centimeter. Here length of fallopian tube is about, that is our question. So option A 10 centimeter is there. That is correct answer. If 10 to 12, it is range is given means that is also correct. 10 to 12 centimeter, that is the normal length of fallopian tube. Fallopian tube is one of the important part of in fertilization. That is, fallopian tube allow the passage of an egg from the ovary to uterus, and also fertilization takes place in the ambulatory portion, ampulla of the fallopian tube. Okay, here our question is length of fallopian tube. So length of this fallopian tube is in our option 10 centimeter is correct. In my golden points, number 65, the length of anatomical length of various body parts is there.